Let's take a look at the coding guidelines in ICD-10-CM, Chapter 4, Coding Guideline 1C4A6. This one is for secondary diabetes mellitus. So we're going to look at this first section here in this video. This Coding Guideline 6 says that codes under categories E08, diabetes mellitus due to underlying condition, E09, drug or chemical-induced diabetes mellitus, and E13, other specified diabetes mellitus, identify the complications or manifestations associated with secondary diabetes mellitus. It goes on to say that secondary diabetes is always caused by another condition or event. And it gives you a few examples, such as cystic fibrosis, malignant neoplasm of the pancreas, a pancreatectomy, or an adverse effect of a drug or a poisoning. So this coding guideline is broken down into two main parts, Part A and Part B. And Part A says secondary diabetes mellitus and the use of insulin or oral hypoglycemic drugs. And B will be assigning and sequencing secondary diabetes codes and its causes. So right now we're going to focus on 1C4A6A. Secondary diabetes mellitus and the use of insulin or oral hypoglycemic drugs. So, Coding Guideline 1C4A6A says, for patients with secondary diabetes mellitus who routinely use insulin or oral hypoglycemic drugs, an additional code from category Z79 should be assigned to identify the long-term current use of insulin or oral hypoglycemic drugs. If the patient is treated with both oral medications and insulin, only the code for the long-term current use of insulin should be assigned. Code Z79.4, which is the long-term use of insulin, should not be assigned if the insulin is given temporarily to bring a secondary diabetic patient's blood sugar under control during an encounter. So let's take a look at this following scenario. 24-year-old female evaluated for her diabetes mellitus due to cystic fibrosis. Her blood glucose is currently under control with daily insulin and oral hypoglycemics. All right, so when we read this short scenario, we can recognize right away that the patient has secondary diabetes because the documentation clearly says that the diabetes is due to the cystic fibrosis. So we want to start with that underlying condition, cystic fibrosis. So in the index, we'll look for the main term fibrosis and then cystic. Now, because we know that it's the cystic fibrosis has this manifestation of diabetes, we are going to continue with our subterms and use the connecting term with and then specified manifestation. And we're going to choose the code E84.8. And when we go to the tabular, we see that that's a complete code. We may want to look at the category level, see if there's any additional notes that we need. But this is our first listed code, E84.8. Now we need to code the diabetes. So for that, we'll start with diabetes. And because it's due to the cystic fibrosis, our subterm then will be due to underlying condition. So you'll see the subterm contains the due to underlying condition, all four words. If you just go under due to and you're looking for underlying, it's not going to be there. So remember that subterm that we're looking for here is due to underlying condition. Okay, so we just choose the default code here because we have no additional specification. So we choose E08.9, and here's the code, and that is a complete code for our situation, and we will list that as the second code. Now we need a long-term use of medication code. And the guideline told us that when the patient takes insulin and oral hypoglycemics, we should only code the long-term use of insulin. So our main term is long-term, There is a dash between those two words if you're using the E-code book. Long term is your main term, and then we need the subterm for the drug, insulin. And we come up with Z79.4. So here it is in the tabular. It is also a complete code. And our coding scenario is coded then with the 3 codes in the order listed. And that's how to apply Coding Guideline 1C4A6A.